Hi, this is Mike D, and I'm coming to you from Columbus, Ohio. I'm standing in front of the State House in Columbus, where they're going to be having a rally today. People's Empowerment Coalition, Putting People First, and Community Action Partnership of Dayton, Ohio is having a rally in Columbus to make people aware of Medicaid expansion in Ohio, and they're going to have a rally to remember all those who have died from lack of health care in Ohio. I'll be talking to some of the people involved in this rally. This is Mike D reporting from the State House in Columbus, Ohio. Okay, hi, this is Mike D, and we're talking to Kurt Bateman about a rally that we're having in Columbus today. Could you tell me a little bit about yourself, what organization you're with, and why you're here today, and what you hope to accomplish?
Yeah, hi, I'm a retired UAW member. I'm also a member of the Single Payer Action Network of Ohio. We support universal health care for all people, regardless of their means or employment status. We're here today to support the expansion of Medicaid under the Affordable Care Act, because we see it as a good way to get more access to more health care publicly funded.
It's Mike D, and we're here talking to William Wallace. We're in Columbus for a rally. Could you please tell us a little bit about yourself, what group you're with, and why you're here today, and what you hope to accomplish?
Okay, yes. Again, my name is Will Wallace. I'm with the Contat Center, which is a nonprofit organization in downtown Cincinnati, in an economically depressed area called Over the Rhine. And we've been working on a lot of different issues over the years: economic security issues, education issues, poverty issues, and also health issues. And the reason why we're here today is because of Medicaid expansion. And we believe, and along with all the other faith groups and other groups we're here with, that Medicaid expansion should be here in Ohio and should be available for people to have Medicaid expansion for people in Ohio. There's over 800,000 people without any health care in this state, and we believe that that's just wrong. The governor has endorsed, Governor Kasich has endorsed this plan, this Medicaid expansion plan. Of course, President is under the Affordable Care Act, initiated by our President Barack Obama, and we believe the people in Ohio deserve to have health care. You know, I think health care is a fundamental right. You know, everybody needs medical care if they have illnesses like diabetes, like high blood pressure, things of that nature. So we're here to raise awareness, to raise our voice, and to bring attention to the fight. And we're in a fight for this. We're actually in a fight for this Medicaid expansion in Ohio. And the latest word we've gotten is that there's a lot of pushback from people in the state assembly on the other side of the aisle who are against this plan. So we're here again to fight and to make our voices heard to people in the State House and let them know we're gonna, fight till we get what we want, which is Medicaid expansion for people in Ohio. And one of the things people don't realize is that 43% of people on Medicaid are elderly. 23% of people on Medicaid are disabled. And then you got a lot of women and children that are on Medicaid. So when the other side is talking about this is going to be a pull or strain on the government or on the state government's budget, they're talking about people who desperately need this care. We're talking about, again, older people, senior citizens. We're talking about people who are disabled. I got a brother that has a disability. My wife's got a son that's got several disabilities. I even have a disability. And so we believe that the State House is the place where we should be to bring this fight to Columbus, and to make sure that the elected officials, all the elected officials, hear our voice and hear that we're serious about trying to make Medicaid expansion a reality for the people in Ohio.
Is there going to be a bill before the legislature soon that you're going to be pushing?
we hope it is. By my understanding is that Medicaid expansion was supposed to be included in the governor's budget. At this point in time, there's a question about whether or not that Medicaid expansion is going to be actually in the budget, and so that makes our fight even more a demand right now to make sure that that Medicaid expansion is included in the budget. There are people on the other side of the aisle, again, who are trying to extricate that from the budget. We think that's wrong. We just want to make sure that, again, Medicaid expansion is here for people in Ohio.
So you're going to be talking to some of the legislators today and some of the state senators and representatives?
Absolutely. We're planning to have a demonstration, a rally in front of the State House. We plan to march to the State House, around the State House, and again having a rally in front of the State House. We plan to do that early, and then this afternoon we plan to set up appointments to meet with the legislators, our elected officials, and strongly suggest and highly recommend that they get behind and support the Medicaid expansion for people in Ohio.
Okay, thank you very much.
Sure.
This is Mike D, and we're with these people. They're rallying today for Medicaid expansion. I'm talking to Lynn Williams, who's been active in this sort of thing for years and years. And you're in Columbus today. Tell me a little bit about why you're here and what do you think you're trying to accomplish?
Sure, but we are actually picked a really important day to be here because the news broke out that the House Republicans are turning back the Medicaid expansion money, and we are completely appalled because that would have brought health care to thousands and thousands of low-income Ohioans across the state who are now lacking health care. And many of our people gathered in this room here today could end up dying if they don't get prescription drug medication and the needs that they have for health care. We have one person here, she just walked away, but she needs kidney medicine. She needs help to keep her kidneys from shutting down. We have someone at the Contat Center who needs her diabetes medicine, her insulin, and needs thyroid medication. We have numbers, many people's stories who we see every single day who are involved in the struggle to get health care. We had a ray of light when the governor put it in his budget to expand Medicaid. And now it's being pulled out from under us unexpectedly, and we are actually in shock. That Ohio's legislature would turn back all this help for people, for human beings, so they can have their health care needs met. Our view is a human right that in the wealthiest country in the world, everybody should be able to have their medical needs met. It is a basic human right. And I'm going to turn this over here. Right now, we have Tammy, we have Hattie, we have John, Christina just walked away, and Jessica. Everyone, some traveled from Youngstown, Ohio today. We came from Cincinnati. We have Cleveland people here, Dayton people, Columbus, and everybody is united together to fight for putting Medicaid expansion back in the state budget.
Thank you very much.
What do we want? Health care! When do we want it?
Now!
What do we love to hear your voice. Yes. What brings you out today?
I'm here in support of those 185% of the people that live in the state of Ohio who do not have health care and who are truly in need of health care, mental health, food stamp, and all of the other basic necessities that the other 2% have.
What message do you have for lawmakers who made this decision today?
Please do not cut the needy items that the majority of the people in the state of Ohio need.
Okay, very good. Thanks.
Sandra Barham from Cincinnati, Ohio, part of the People's Empowerment Coalition that put this organization together, and from PEC. I need health care. I'm one of the 38% that does not have health care. They keep putting me in the hospital for my high blood pressure. And I am tired of going to the emergency room for health care. And I need this law, Medicaid expansion, to pass. I understand that they're going to leave in the thing for people that have insurance that they're going to pass for people with drug abuse, but you need to think about the people that don't have insurance, that are able-bodied people that work part-time every single day.
Are you amazed that you're fighting this fight with John Kasich, who is now battling his own party?
Yes, that is amazing, because he actually was the one that put this in the bill. He passed the bill. And now that the Tea Party wants to take it out and he's got so much offense, that's not fair to us.
What's your message to the Tea Party?
My message to the Tea Party, I need health care. Help me pay my bill. Help me continue to work.
Health care and human rights.
Demonstration talking about health care being a human right.
They just stopped somewhere. They sitting on the wing president.
What do we want?
Health care.
When do we want it?
Now.
What do we want?
Health care.
When do we want it?
Now.
When do we need it?
In time.
Rest in peace, T.
Tiffany, because she did not get her drug medication in time. Tom, who died.
Rest in peace, Tiffany.
Clifton, who died because they did not detect the cancer in time so he could be treated.
Rest in peace, Tom.
We are fighting for people's lives in Ohio, and we call it shame on the state legislature if they refuse to help the poor of Ohio.
Shame on you. What's that spell?
Health care.
We remember one of our members, Sandra Walker.
This has been Mike D reporting from the State House in Columbus, Ohio for novachimp News.